On today's episode of The Evolved Nurse, Bridging the Gap, we have a woman from a small town who was a girl with a big dream. She saw a pain point in the healthcare industry as a child and decided to dedicate her life to doing the work. From ag school to farm school, a true Jill of all trades, one of my residents from undergrad. Welcome, Dr. Airline, RPH, PharmD, to the Evolved Nurse podcast.
Oh my God, that was a beautiful intro. Thank you so much.
You are so welcome. So, here on the Evolve Nurse podcast, we normally talk to nursing students, but I started my Bridging the Gap series because I saw that we also need to collaborate with other people in the healthcare industry in order to make patient care seamless. So, the first question I always ask is, did you always want to be a pharmacist?
Absolutely not. I think that it's ironic, or I guess kind of surprising when people hear me say that.
Hmm.
Um, Probably the only person who's not surprised to hear that probably would be my father,
Oh,
um,
wow.
because my dad is like my best friend, and I think that earlier on in life, he saw the fullness of who I was.
Mm-hmm.
And, he knew that my passions and the things I love to do were more geared towards cosmetology. So, hair, makeup, beauty, modeling, that kind of thing. I got into makeup, dressing up, all that stuff really early on, doing my own hair, doing other
Mm-hmm.
people's hair
You did mine.
as a child. Yes. So, I remember telling him, about that I felt like there was something I needed to do when my aunt
Mm-hmm.
passed. And actually my father was the one that helped me figure out which career to go into. Because I honestly really didn't know that much about pharmacy until my aunt had passed away. So yeah, absolutely not. People always ask, when people ask the question, what would you be if you weren't a pharmacist, is always hairstylist, makeup artist, beauty modeling. I would be, girl, like a little Lori Harvey or something, girl. That would definitely be me.
Yes. No, when we were in undergrad, like, you were doing people's hair out of your room.
Absolutely, girl. Hair, eyebrows, lashes, all that.
And I didn't even know the extent to everything you were doing out that room, girl.
Girl,
Goodness
listen.
gracious.
Gotta get it by any means necessary, honey.
Yes. So, since I know, like, y I just lost my dad. So
Yeah.
hearing you speak about your dad in such a candid manner and how he helped you and leaded you to where you needed to be, girl, that was my dad as well. So I am just so appreciative to hear the relationship that you have with him, first of all. But second of
Oh,
all,
thank you.
what was it that you learned about your aunt's disease process that made you want to go into pharmacy?
Okay, yeah, thank you for asking that. That's a great question.
Mhm.
So, um, I guess just kind of a little bit more detail to kind of understand. So, in addition to my aunt passing away from complications of diabetes, I was diagnosed with ulcerative colitis at the age of
Okay.
12.
Okay.
So, I had experience at that time. She passed away when I was 17, um, about 6 or so months right before I graduated high school the following year. Um, and I'm from a very small area, very
Mhm.
rural area, limited access to healthcare. Even when I would be going to my specialist for my treatment for UC, I would have to go to Macon, Georgia, which was about a 3 hour or so drive. And back
Mhm.
then, honey, there was no iPhones, no Google Map,
Mm-mm.
Apple Map,
Flip
honey. Remember, they had to
phone.
print those
Yes.
directions
Turn
off on
left, turn
MapQuest,
right.
honey. Yes, so honey, I was Siri, okay, in the passenger seat, helping my daddy navigate through traffic.
Mhm.
Um, so all of those things kind of came together, I will say, when my aunt passed away at 17. So um, again, I was from a very small area. My aunt and I actually, she would room with me at my home with my
Mhm.
mother. My mother basically became her primary caretaker. Um, so my aunt was someone who she would be categorized as, and forgive me if I don't say the correct term, but
Mhm.
someone who had, mental cognitive deficits.
Uh-huh.
Um, So although she was an adult, she was 38 years old when she passed. She was someone who was very childlike. I don't even know if she ever had a diagnosis, but she probably would be someone that would be categorized as having autism, of some type of, mental retardation type,
Mhm.
um, um, you know, disorder or condition.
Mhm.
So she basically couldn't take care of herself, or have the understanding of her disease. So that was then my mother's job. Um, their mother, my aunt and my mom's mom, my grandmother, she passed away from diabetes and complications of diabetes as
Mhm.
well. She was 64 years old. So all of those things start to come together, and I was very close to my grandmother and very close to my aunt. As you can imagine, she and I sharing a room together at my
As you're
home.
growing up. Mhm.
Yeah, as I was growing up, so I was the person that would help my get ready for dialysis every Monday, Wednesday, and Friday. Um, I would get up with her at 3 o'clock in the morning before I would go to school, help her with breakfast, help her with her medications, take her pills, check her glucose, prick her finger, drop her insulin, logging
Mm.
her, her glucose levels in her little booklet. Um, all that, because I had watched my mom do it so much, and that
Mhm.
over the years I got older and I could help her. I could do it on my own. So yeah, so she and I grew tremendously close, during those times. So her death was unexpected and sudden, and it devastated me. Honestly, she was my best friend,
Mhm.
and that was the moment that I knew I had to do something, because at that time, as a 17-year-old girl living in a rural area, I felt that I was losing all of the people who were so important to me to this
Yes.
disease. So it made me curious. It made me angry. Um,
Mhm.
and so I just decided that I was going to take that pain that I felt and try to help other people in my area, in the rural community, get a better understanding of health literacy, of your medications, how to take them properly. That's where I felt the gap was in her healthcare. I felt that, maybe there were doctors and nurses on board. I didn't go with her
Mhm.
to any of those appointments, but I felt that there was more that could have been done, to explain to my aunt's caretaker, my mom, making sure that the health literacy was up to par there. Because I feel like that was the huge gap. The gap was educating on medications, making sure they're being taken properly, explaining the importance of adherence, and getting the buy-in from the patient or the caregiver, so that the patient could have optimal results, and live a healthy, long life. I felt that, she was robbed of that, honestly.
Mhm.
And so, yeah, it made me just want to go and learn so that I could pass information on back to those who needed it.
And you know what? This is the epitome of bridging the gap, because we all have, like, people have common stories together, but I have a similar story where my aunt, who had a similar mental situation as yours, she also had diabetes, and she was older when she became that way, so she didn't care about what people
Mm,
were telling her.
mm,
She would eat like a loaf of bread if she wanted to, like, because that would satiate her want for sugars.
mm,
But when I saw this disease process as a child, very much similar to you, I didn't know that it was as serious as it was until I became a medical professional.
absolutely.
So when I started nursing school, like, younger, I always recognized that diabetes was something that was talked about in the Black community as
Hmm.
just this disease that is passed down from generation to generation, and it's almost inevitable that you
Yep.
will get it.
Hmm.
And very young, I knew that that wasn't true. So I
Absolutely.
started eating differently than my family. I started exercising more than my family. And I then found out that, through exercise, through meal change, because not only do we have our genetics that are passed down from generation to generation? We have these recipes that are passed down from
Culture.
generation to generation. We got these cookouts. Girl, my daddy used to get on the grill and he used to be like, "Boo, you gonna eat this food?" And I'm like, at the time, I'm vegan, and I'm like, or pescatarian. I'm like, I can go get you some fish to put on the grill. Or he'll make some greens and he'll put some pork in them, and I'm like, "Daddy, I
Yep.
don't eat pork." He's like, "I'm just seasoning it up with it, baby. You could just take it out." I said, "That is not how this works. That is not how this works." But during my nurse externship, I did home health care, and we went to so many Black people in a rural area
Mm-hmm.
where they had amputated legs, they had
Yes.
wounds that wouldn't go away on their feet, they were going
Yep.
blind. And then I recognized how they were being taught.
Yeah.
They're not being taught that this disease is serious.
Mm-hmm.
It's just the sugar.
Mm-hmm.
They don't understand why the wound on their feet is not healing. They don't
Exactly.
understand why they barely can see, because
Mm-hmm.
diabetes affects so many systems in our body
Mm-hmm.
that, we are if we get diabetes, we're more subject to amputation, more
Exactly.
subject to heart attack, more subject
Mm-hmm.
to kidney failure. It's affecting
Absolutely.
all these areas.
Mm-hmm.
So, when speaking about bridging the gap on my side of things, I see it as a full process. On your side of things, you see like the adherence to medication isn't happening because our medical professionals aren't translating that over to the patient where they're telling you, "Hey, this is a serious disease." It's more
Right.
like, "Hey, take this medication. You have diabetes, and let's try back for to see what your A1Cs are gonna be later on."
Exactly. And I'm glad that you mentioned that because um, two things that I want to say
Mhm,
is like we were talking about the culture. So me being in my family, I was probably the smallest person in my family. Okay.
mhm,
So seeing how the culture and how, the meals that were being prepared, um, my mother, and this is no disrespect or shade to my mom,
mhm,
because I understand that it's culture.
mhm.
This is how the African American community is. You put the
Turn
same amount
slop
of
into soul food.
Yes, and you
Mhm,
put the same amount of food on everybody's plate. It don't matter the size. So I'm trying to eat the same portions that everybody else is eating, and I'm smaller than them. I have a higher metabolism, but I'm just looking at all of this. Even my sister being borderline pre-diabetic when I was younger. So,
mm,
they don't teach you, like you said, that the condition or the disease is reversible
mhm.
and preventable. It's almost as if diabetes is a part of the family. It's a sibling. You
Yes,
know that it's gonna
it's
be
our
there.
best cousin.
Yes, you know that somewhere, somehow, diabetes is gonna come in and take up space somewhere. It's just we have accepted it, and that's the norm, and that shouldn't be the case. So, absolutely, I think that healthcare professionals should be doing a better job of telling patients that you're going to get this medication and we're going to, like you said, you're going to return it. We're going to check your A1C. But with food changes, lifestyle modifications, and exercise, we can reverse this.
Mhm,
As you said, diabetes affects all the systems of the body. I watched my aunt have cataracts. I watched her be in need of a kidney, going through kidney failure and being on the kidney list for years. Um, I saw all that. I saw her having to have emergency surgery. She almost died one time, even before that, she had this incident. So, I, and same as you said, the wound. My grandmother had diabetes. She had an amputated leg. So I saw that at 7 years old. So when you are growing up as a child in the African American community and you see that often, you start to
mhm.
think that this is norm. This is
Yes.
normal. That this is what I'm gonna endure or go through in 60 years from now. But even then, in the African American community, it's almost as if um, this it's so common that it doesn't even bother anybody in the African American community. Like to
Yeah.
see my grandmother have an amputated leg, but it just be such a nonchalant thing. Like
Mhm.
you're missing an entire limb. Like why are we not talking about this even in our households? Why are we just acting like this is normal that grandma went to the hospital, had her leg chopped off, and now she's coming back home? And so my aunt, before she passed away, she had a wound on her toe. It was a small wound, very small, on the base of her big toe. And there were conversations about possibly getting the toe amputated. Then it needed to be the leg, the lower leg, and then all this stuff. And before we could even get into surgery or set any of that up, she passes away.
Mhm.
So it definitely needs to be addressed more. And I definitely believe that it's my life's mission to start a nonprofit,
Mhm.
and be able to provide either medication therapy management services to rural areas, or just go in, give presentations, helping them to understand the condition or the disease, and give them tools and resources and education so they can feel empowered that there
Yes.
is something you can do about this. You don't have to just accept the diagnosis and
Mhm.
okay, that's it, go home. I'm
It's a
going to be on
life
this
sentence.
medication. Yes, I'm going to be on this medication till the day I die, and that's that. And no, that's not the case. It's not the case at all.
I just remember growing up and people saying, "Yeah, this runs in the family. It runs in the family."
Yes,
And like my dad saying that he was pre-diabetic for so long to kind of like ignore the fact that he was actually diabetic.
yeah,
And what's crazy is my dad knew that he needed to change his diet. But
mm-hmm,
because now it's a habit, it's habitual how you eat.
yep,
It's an addiction, you
mm,
know?
it is. Mm-hmm.
I'm calling him, he like, "Yeah," not trying to tell me what he's doing. My mom is yelling from across the house, "Keisha, he over there eating them cookies." And I'm like, "Daddy, why?" He was like, "Look, I don't even know why she's sitting up here telling on me." So, while I am, glad that he lived his life how he wanted to,
Mm-hmm.
I'm also, like you said, angry at these disease processes that
Mm-hmm.
could have been stopped. I remember my dad went to the hospital and his blood sugar was in the 400s. He
Oh wow.
drove himself to the hospital with his blood sugar being that high and was still saying he was pre-diabetic. No, daddy, you're not pre-diabetic. You're full-blown diabetic and it's
Yes,
uncontrolled and you're not
yes.
adhering to what needs to be done. So, yes, I'm almost wondering, and I saw this while I was in nursing school. There was a diabetic clinic that they could assign people to for clinical. And
Mm.
so they would rarely send black students to this clinical site, but they ended up sending one. And she said, "You saw no black people because it was referral basis."
Oh
So,
wow.
this is where they're teaching people what diabetes is. They're teaching them how to
Mm-hmm.
curb it. They're teaching
Mm-hmm.
them what meals they should eat. They're teaching them and doing exercises and things with them. But in
Mm-hmm.
our community, we lack that.
Yeah.
And so I'm almost wondering if grandma knows that her leg got cut off because she has diabetes.
Mm-hmm.
Or if she just feels like, hey, it's my mama got her leg cut off.
Exactly. So it's okay.
Yeah, so it's okay. But to pivot out of that, because I feel like there is such a cloud over pharmacy. Like we just don't know. It's like a curtain over pharmacy, and we have no idea what goes on in pharmacy. And it may be very ignorant of us, but I feel like we know pharmacy on a very surface level basis, and we need to know more.
Absolutely.
Go ahead.
Oh no, you can go ahead. I'm sure maybe there was a question.
Okay. So, first of all, what are your job responsibilities as a pharmacist?
Okay. So the job responsibilities of a pharmacist, obviously they can kind of change based on what area of pharmacy you're working in. Um, so I guess I'll kind of start there a little bit. So I think that people are definitely unaware of all the different roles that
Mm-hmm.
a pharmacist can embody. I think that the most common, obviously, is retail. But pharmacists also work in hospitals and institutional setting. We work in for the CDC, the FDA. We even work within big pharmaceutical companies, the companies that actually produce the medications.
Mm-hmm.
So, as a pharmacist, our job entails that we are the medication expert. We learn about diseases and we get a foundational understanding of the disease and how it works, obviously, so that we can know how the medications and the products that we're going to use will impact that disease. But essentially, we're the medication experts. We also are experts on clinical trials, understanding the data from clinical trials, understanding the clinical significance of the trial and how that applies to certain populations of people. Because obviously, we're talking about diabetes and African American population. There are diseases that disproportionately affect certain demographics than they do others.
Mm-hmm.
So when it comes to the medications, we understand drug-drug interactions, how the medication works in the body, how it's absorbed in the body. We understand different formulations and how the formulation of the medication can change how the medication is absorbed, the efficacy of the drug. We understand drug disease interactions. We understand just looking at the patient holistically,
Mm-hmm.
and being able to evaluate and analyze if there are any changes that need to be made. And then we make those recommendations to the physician. I guess a simple way to kind of look at it is I saw someone say on Facebook that we make sure that your doctor, is not killing you per se.
Mm-hmm.
Because patients can have multiple doctors. They'll have a primary, they'll have a cardiologist, they'll have an endocrinologist, they'll have neuro, and most oftentimes, what I see, especially working in rural areas, or just in different settings, a lot of patients do not understand the importance of making sure, even though when you go to the doctor, it has it on the paper, your doctor talks to you about all your drugs that you're
Mm-hmm.
taking, they don't understand the importance of telling the primary that the cardiologist has me on this medication. They
Yes.
don't understand the importance of telling the cardiologist that the PCP has me on this other medication. So I'll see oftentimes a simple example, patient taking pantoprazole and omeprazole. GI giving them pantoprazole, the
Oh
PCP
boy.
giving them omeprazole, and they're taking both of them.
Mm-hmm.
Just things like that. They don't even understand the importance of over-the-counter medications. Most people think that because it's over-the-counter, that it's harmless, and that's not always the case. So I believe that the work that we do definitely doesn't. I won't say get the recognition that it needs. I think that it's just not as understood as nursing and as the roles of MDs. But yeah, we're there essentially. I like to think of it as almost like the three branches
Mm-hmm.
of government, how they work together: legislative, judicial, executive. So it's pretty much how I view physicians, pharmacists, and nurses. We're all there to each do our role and make sure that there is balance, that what the
Mm-hmm.
doctor is prescribing does actually treat this condition, that it is appropriate, that it is optimal, that you are abiding by the guidelines. Because I see that a lot, especially with the Ozempics and the Wegovy's and all of
Mm-hmm.
those things. I have a lot of patients who sometimes, quite frankly, get upset with me when the doctor sends over a prescription for an Ozempic 2 milligram, and I'm like, okay, but when did you start the starter dose? When did you start the 0.25? And they
Mm-hmm.
get frustrated, but I'm like, it's important that you take the starter dose and then titrate up the medication per the guidelines. And the guidelines are there based off of the clinical trials. So it's important that you do that so that you can get the optimization of the medication, but also to help mitigate side effects. Because I'll have
Mm-hmm.
also people, calling, and they'll be in pain or just so uncomfortable because they're having diarrhea and nausea.
Yeah.
And it's because, the doctor may have titrated up too soon and now you're not tolerating it. and the doctors, because you wanted the 2 milligram, whatever.
Mm-hmm.
So that's what pharmacists do. We help to make sure that the patient is safe while using the medication, and also that the medication is optimized to get the most benefit from it.
Okay. So, I rarely see pharmacists that do thorough medication reviews in which you say. So, there
Hmm.
have been times where I've looked at medications and I'm like, hold on, they shouldn't be on these two drugs at the same time. So, I'm calling pharmacy and we're collaborating because that's what we're supposed to do. But doing
Hmm.
medication reviews, understanding medication interactions, you said that, y'all really aren't recognized for all that you do. Just being 100% honest. Most of the times, we're not recognized for all that we do, but pharmacy, y'all are like in the background because we rarely see y'all in like true interaction. Y'all might
Yeah.
tube us up some medication. I'm
Yep.
calling the farm tech to come down and get some medication, but we rarely see the pharmacist.
Yeah.
So, y'all are the safety net of the
Yes.
medical industry.
Yes.
We all have to participate in patient safety, but our doctors might just be treating one disease process, especially in the emergency department. They don't care
Yeah.
about all the other stuff that a patient has going on.
Exactly.
They're treating one thing.
Exactly.
So they're not really recognizing all of like the person as their holistic lifestyle, as
Exactly.
opposed to this one disease process. So I'm
Absolutely.
so I'm glad that you brought up the Ozempic titrations because like with steroids or anything, antibiotics, most of our
Hmm.
patients don't understand that we may tell them over and over again, take all your antibiotics, because if you don't, I try
Yeah.
to explain it in a way in which they understand because sometimes we have to understand that our patients aren't always medically literate. Like
Exactly.
sometimes I hear words that I don't understand, so how do I expect for them to understand what I'm saying? So I always break it down like you have to take every one of your antibiotic pills. If
Exactly.
not, you end up creating like a super virus, a super
Hmm.
bacteria where whenever you don't take this, the next time you end up getting that UTI, that medication isn't going to
Exactly.
work for you anymore because you've exposed it to this medicine. They've ate up a little bit. They didn't die. They was on their last
Hmm.
leg, but you forgot the last pill. And now they coming back strong. They're like, I don't even care. I don't even care that
Exactly.
you take that. I'm
Exactly.
good.
Exactly.
So, what area of pharmacy do you work in?
So I currently work in retail.
Mhm. And so, how is that for you as far as patient interactions?
So honestly, it's the best. I
Mhm.
mean, retail pharmacy is probably where you're going to get the most direct patient to pharmacist interaction.
Mhm.
Um, and I absolutely love it. I think that I get to show my personality a little
Mhm.
bit more and be more relatable to people. When they come in, they get to see a face. They get to see that you are invested in their health. Um, so yeah, I actually love it. It's honestly what my plan always was. Upon graduation,
Mhm.
I did kind of have some other interests. So I did do residency and fellowship. So I do have those things, and I'll probably transition at some point. But yeah, I love retail.
Okay. And so in retail, that always allows you to be like for customer facing. And
Hmm.
so, like, if they have any questions, they should feel comfortable coming to you. But I've seen often in retail spaces, like we see the pharmacy tech. Normally, they give me my paper, they ask me to sign, and then I'm
Hmm.
on my way. But I think
Hmm.
it is imperative that we have like open conversations about medication with our patients. And so I'm glad that you're in the retail space to bridge that gap for patients, pharmacy, and the doctors so that the patients can understand what they're taking.
Absolutely.
Oh my goodness. Look, I am so excited that you have created, excuse me, you have created like a space for patients who are in, you're in a rural area, correct?
So I
Oh,
heard
me
this is called,
too.
I know, I couldn't wait to tell you that. So I hear that people refer to this as the big country.
It
So,
is.
so
Yeah.
take it for what it is. Some people may consider it the city, some people consider it the country. I definitely think that it's the big, the big country because I'm a
Mhm.
country girl.
And it
But
feels real
yeah,
country. Mhm.
it does, and I love it.
Aside from, like it's when you come in contact with it, you'll know, but the mannerisms here are very different. People aren't gonna hold the door open for you all the time. They're not gonna speak
Yes.
to you all the time when you come in the store, so that's gonna be a culture shock because it was for me. I was like, "Why didn't they speak when I walked in here? I'm not used to
Yeah.
that."
Is
I
this your
mean,
first time living in Jack, or like really being in Jack, visiting or living here?
no, I've been in Jack for 4 going on 5 years now.
Okay, 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 okay.
Mhm. I've been here for a while, yes. So as a pharmacist, what can you tell nurses that they could do to better make our relationship?
I would say, whether it be in the retail setting or in the
Mhm,
institutional setting, because I do have experience again working in a hospital, is just two things: communication and teamwork.
mhm,
Nurses and pharmacists, as you said, although we don't, well, I will say that um, there may be a difference in experience
mhm.
because there's a central pharmacy in the hospital setting. So, those pharmacists you may not see that often, or maybe not at all, because they're
See 'em during
centralized.
codes.
Exactly. Or yep, or doing a code. Yep. So they're in the central area. So most of the
Mhm,
time you probably are just sending messages through whatever EMR system you're using,
mhm,
um, walkie talkies, whatever the hospital uses, or phones. But then there's also decentralized pharmacists as well who help to round with physicians and nurses, whether that be in oncology,
mhm,
psych, whatever the disease is. So I would say communication and teamwork. So I think that because the presence of pharmacists is not as strong
mhm,
um, in these areas, that the communication kind of falls through the cracks sometimes. But it's definitely an interdependent relationship. The nurses are putting in the orders or sending the prescriptions to the pharmacy, and the pharmacist, it's their responsibility to get the medication prepared, review it, prepare it, and get it back to the nurse in a timely fashion. If it's a hospital setting or if it's retail, reviewing it if there's any discrepancy with it, calling the nurse as quickly as possible so that there's time throughout the day for it to be corrected so that the patient can still get the medication in a timely fashion. Because you're racing against that clock in retail if that doctor's office closes at 5 o'clock,
mhm.
and that patient is going to be coming. They want that medication.
And they want it on time. They want it as soon as they step their foot out the door. They're like, "Do you
Listen,
have my prescription filled yet?" "No, you gotta give us some
listen.
time." "Well, I just got here, so speed it up."
Listen, I can't wait till this podcast airs because I'm gonna send this out and I need everybody around the world to listen to this. Okay.
Yeah.
Retail pharmacy is not a fast food restaurant.
Oh, girl, say it.
I love y'all to death. I love my patients. I love serving my community. I love serving you guys. But it is not an immediate process. Um, so as a matter of fact, whenever you leave a doctor's office and they say that they sent the prescription, it could still take an hour, up to an hour, for it to be communicated over to us. And then from that point, the pharmacist, it has to be typed, entered. The pharmacist has to review it, evaluate it, make sure that the prescription makes sense from a disease standpoint, a medication standpoint. Just even the verbiage is
Mhm.
understandable, and
'Cause
everything
we
has
know
to
what
be
those
there.
prescriptions look like.
Yes,
Yes,
and everything has to be there, because there are laws and regulations that say X amount of information has to be clearly stated on the prescription. If it's not, then I can't fill it by law. So, but yeah, so I would definitely say just communication and teamwork. doing things in an efficient and in a timely manner. I think that, we just have to extend grace, because I can remember being in an institutional setting, and, sometimes nurses are overwhelmed and they
Mhm.
don't, get those orders in a timely fashion. They, may put it in last minute, and the patient need their medication. So, just learning how to prioritize, the needs of the nurse,
Mhm.
based upon the needs of the patient. So just letting the pharmacist know, what you need.
Mhm.
If there's any question that you have about a medication, and if it's okay for the patient to take, those things like patients having impaired kidney function. Does a dose need to be adjusted? Um, is this medication, how is it eliminated from the body? All those things. Any question that you have as far as the medication, or and how it's going to work in the body or the disease state. So pharmacodynamics, pharmacokinetics, go to your pharmacist. That is the person that you need to talk with, um, to make sure that, again, patient will be safe and will be able to treat the disease appropriately. um, but I did want to mention, I'm so glad you brought up about the antibiotics, because, girl, I think that especially in the Black community, I don't know who started
Girl, for
this
everything.
habit. I don't know who started this, but
Antibiotics for
we need to
everybody.
address it. Okay, I don't know who started the when a doctor writes you a prescription, that you take a little bit of antibiotics until the point that you start to feel a little bit better, and then you're gonna hold
Mhm.
some and put it in the cabinet and hold it for the next time that you may need it. But yeah, so yeah, we're definitely contributing to antibiotic resistance. So,
Mhm.
as you said, the next time you may need this, it's probably not going to work as effectively, because I don't think that people, not just in the Black community, but even people who are not involved in healthcare, I think that when it comes to infection, people don't understand that bacteria and viruses are living organisms.
Mhm.
I think that because
Like
they
you
don't
and me,
see it with the
just living
eye,
around.
yes, is because you can't see it with the eye, and it doesn't have a leg or a head or arms, you don't understand that it's not a living, breathing thing that eats
Mhm.
food, that literally poops and all that, just as we
Mhm.
do. So, as you said, you have to feed it poison and basically take it out. And sometimes it's a slow process. So you definitely got to complete those antibiotics, and listen to your pharmacist when they say no alcohol with your
Mhm.
antibiotics. Okay. So all of those things, I think, just come into play, and could really just help the nurse and pharmacist relationship,
Mhm.
fostering a relationship. I think that whenever we have the opportunities. I know that we get caught into the hustle and bustle of work, and everything nowadays is fast paced. You don't have a lot of time to really talk, but the opportunities that you do have to talk with your nurse or your pharmacist, just build a rapport that this is a trusting relationship. Whatever, when you ask me a question, I got you. I'm going to go look into it if I don't know the answer immediately, and I'm going to get back to you in a timely fashion. That builds a rapport and a relationship where the nurse knows that, okay, I can reach out to this pharmacist. Even if you are in a central pharmacist where you may be evaluating multiple disease states and monitoring multiple disease states, but if you have a specialty or a certain therapeutic area that you are very strong in, let your nurse know that, communicate that. So when your nurse has questions about that, they know, oh, okay, this pharmacist is well versed
Mhm.
in, psych, or well versed in oncology. They have a background in this, they have a background in that. I think that those things are important, whenever you're coming onto the team, to know the background. So that way, everybody has an idea of what the person's strengths are. I know we all have a long list of roles and responsibilities, but sometimes
Mhm.
we are stronger in other areas than others. So um, it just definitely takes communication and teamwork. Those are the two things that I would say about it.
Yes, and to piggyback on what you said on antibiotics, one, throw away your expired medication. I'm so tired of going to my auntie house and my cousin house and
Mm.
them be me looking at the meds and I'm like, "Do you know this Tylenol expired in 1945? Like, please throw it away like the seasonings in your cabinet.
I was just
Let
about
them
to
go."
say. I was about to say the reason why they're not throwing it away is because they also don't throw away those seasonings, honey. So we got a lot of work to do.
Girl,
Okay.
they don't throw away nothing. Oh my gosh.
Nothing.
And two, your meds are your meds.
Mm-hmm.
They are
Yes.
prescribed in dosage based on what
Yes.
you have going on, not what your neighbor
Yes.
has going on. So your
Yes.
antibiotic is not for them.
Yes.
It's for you. And antibiotics also do not fight viruses.
Exactly. Yep.
So we
Yep.
have to start there where we educate the community. And I always, since I'm not bedside anymore, which has been hard for me, not being bedside and having that patient nurse interaction, because during COVID it burnt me out. Like
Mm.
I was developing these relationships with my patients, had their
Yeah.
medications, like I was doing all the things, and then I would come back and they would be passed away.
Yeah. Yeah.
So my interactions with patients is very different now than it once was, which was my purpose in coming into the healthcare space overall, was
Yeah.
to educate patients on disease
Mm-hmm.
processes, especially us in underserved areas.
Mm-hmm.
So with that being said, there are so many people like nurses, CNAs who want to transition, nurses who decide they want to go into higher education.
Mm-hmm.
So they say, okay, you know what? I think I want to go to pharmacy school because things can change
Mm-hmm.
for us. If you're a nurse, you don't have to stay a nurse.
Right.
If you're a CNA, you don't have to stay a CNA. And if you
Mm-hmm.
are just thinking about healthcare, what would you say to people about your journey to pharmacy that will help them create their journey?
Mm. So my journey to pharmacy was, um, I think it was pretty straightforward, to be
Mhm,
honest. Once I discovered what it was exactly that I wanted to do, and I found the role that encompassed that, um, it was pretty straightforward. It was just a matter of getting the right prerequisites and taking the exam, getting accepted, and then going off to pharmacy school.
mhm,
One thing I will say about pharmacy is that I I will say I don't know if it's changed. I have noticed that a lot has changed within pharmacy over the past few years as far as entrance exams to get into pharmacy school,
mhm,
as far as requirements there. But when it comes to at the time when I was applying, it did not require a 4 year degree. It did not require a bachelor's.
mhm,
You could get one, but it wasn't a requirement. So I completed my prerequisites um, in 2 years, and then I took the exam, the PCAT, and got into pharmacy school. So as long as I had all those requirements, that was all I needed, and I went off to pharmacy school. Obviously, the journey and all the day to day was not easy.
mhm.
The courses were rigorous. They were tough courses, heavily based in chemistry, um, in pharmacology. I know a lot of people when they hear that word,
Oh my
you
gosh.
know, they get scared or a little nervous or kind of deterred. But don't let that be a deterrent. It is definitely doable. It's definitely feasible if that's something that you're interested in. I did also work as a technician while in undergrad,
Mhm,
just so that that was a recommendation that I heard a lot of people in pharmacy give, so that you could just begin to get well versed in just the language of
mhm,
healthcare professionals, get a little bit of background and the diseases and the names of the medications, generic versus brand, just kind of start to build a foundation so that once you got into pharmacy school, it wasn't as hard. So I do think that that helped, but I do think that it also there also was some cons to that
Mm-hmm.
because depending on where you work, there are differences in the law when it comes to states. Some states are more strict than others, so you will have to be able to differentiate that while in pharmacy school. That if I'm in pharmacy school in Georgia, but I was a tech in Florida, that there are differences in the law. So when you take the law portion, you will have to be able to keep that straight and narrow in your mind. Um, but other than that, while in pharmacy school, I was heavily involved in organizations.
Mm-hmm.
One in particular, SNAFA. I love SNAFA. It stands
What?
for the Student National Pharmaceutical Association, which is the student organization of NAPHA, or the national organization once you graduate. And in essence, SNAFA was basically doing the work that I wanted to do once I completed pharmacy school
Mm-hmm.
and was able to go back home and do that, which was basically serving underserved populations and areas and educating them on diabetes, hypertension, cholesterol, those type of diseases. We would do diabetes, blood pressure, cholesterol checks and monitorings from in the community. People were able to come in, get their glucose checked, the blood pressure checked, and we were able to just kind of talk with them and give them some guidance on where to go from there. Um, so some people discovered that they were diabetic. Some people discovered they were hypertensive during those times, and some people discovered that they already knew it, but um, it wasn't controlled. So we are able to educate them and give them some pointers and some resources on how to get those diseases under control. So I absolutely would not, you know, change anything about my journey. It was hard. It was
Mm-hmm.
very hard. It took a lot of sacrifice, a lot of missing out on,
Yes,
events and birthdays and trips and travel. And I mean, I still don't know anything about Power
girl.
or all those other shows people talk about. And they're like, oh, you don't know? No, I don't. My head was in the books during that time. There was no time for TV, for extracurricular, things outside of pharmacy school. But it was worth it. It was absolutely worth it. And I would, if I had a choice in doing it all over again, I would definitely do it again.
Okay, because if it was easy, everybody would be a pharmacist.
Amen, girl. Say that again.
Look, everybody would be doing it. But I am so glad that you have created space for your patients, also those people that you work with to be a because I know your personality. So I already know what the workplace looks like for you. I know that you're, very stern in your word, but you're also a very bubbly person. So, with that being said, we are wrapping up this episode. Oh my goodness. It does not seem like we've been talking for this long,
It
Candice.
doesn't. It feels like we just got started.
Oh my goodness. Oh my gosh. We'll have to get together and do this again just for
Absolutely.
some follow-up or to talk about a disease process. But as far as your pharmacy students, what would you tell them? Give a quote or something of the sort to let them know that everything is gonna is gonna fare out fine. You might feel like right now it's feeling like a lot, but what
Mm.
would you tell them to propel them forward and to continue on the journey to this career?
I would say there's a scripture that's coming to mind, and I may not
Mhm.
quote it correctly, but it says, "In due season you will reap if you faint not."
Mm,
When you know that 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 that is what you want to do, then do not let anything or anyone distract you or tell you otherwise. Um, and you can do anything that you put your mind to. I will say that take careful consideration that it is what you want to do
mhm.
and commit to it. and everything else will fall into place. Even the lack of support, if you're that person who may feel that you don't have the support of your peers, of your family, um, do it anyway. It won't be easy regardless. Even with support, it's not easy because you're the only person that has to show up and has to do it.
Mm.
Um, so if this is what you have decided to do or you feel that you've been called to do, because I will say, and I know that people say it often, that working in the healthcare field is a calling.
Mm-hmm.
It is something that you have to, you can't just do it for the pay. You can't just do it, for the aesthetic. And I say that because nowadays I feel that my generation, we kind of get bogged down into that,
Mm-hmm.
the aesthetic of how things look. But do this because it's what's in your heart, and when it's in your heart, it's inevitable. It's going to happen. So just stick with it, hang in there, and I promise you, it'll be worth it at the end.
Oh my goodness. I'm so glad that you said that because regardless of support, you will have to show up for yourself. Nobody knows your vision like you know your vision.
Absolutely,
Nobody's going to see it the way that you see it. And of course, you would want to yell to the hills that this is going to work to everybody, but everybody isn't going to see that.
absolutely.
So, when you were in pharmacy school, what were some things that you did to decompress? Because I know that was a very stressful situation.
Oh my gosh, girl, I don't even think I had time
Look,
to
I didn't
decompress.
either.
Oh my gosh, I've never even thought about that. So, to decompress, um, I mean, I did different things. I think that my friends that I made in pharmacy school, they were a lot more outgoing than I am. Even though, like you said, I do have a bubbly personality. I am like a fun girl to hang out with and that kind of thing. But I'm not necessarily as outgoing as people may think.
Hmm.
Um, I really just do it, because my friends were going. But we would go hiking. I remember going to Tallulah Falls, and hiking. So that was something that I did. But I think the thing that probably helped the most was exercise.
Hmm.
Um, I think that people kind of don't see that as a way to decompress, but for me, it was definitely a way to get out some frustration. So I'm 150 pounds trying to lift 150 pounds on my back trying to squat, like the effort and the force that I have to use, to get it, to do that. Like that was how I dealt with, with stress. Boxing, kickboxing, some type of physical activity that I had to challenge myself with was a way that I could kind of release frustration, anxiety, fear,
Hmm.
and all those things outside of me being heavily involved in faith, investing in that. So prayer and meditation, um, reading and studying my Bible, um, journaling. Those are ways that I think I didn't see it as me decompressing, but I think it was definitely things that kept me anchored and grounded and quite frankly kept me sane because there were a lot of
Hmm.
times I thought I was going to not make it. Um, so yeah, those are some of the things that I did.
Okay. Are there any books that you're reading currently that you would recommend to others?
In general, or like pharmacy type, I guess, like career type
In
thing.
general.
I'm currently reading Sarah Jakes Roberts' Power Moves book
Okay.
because earlier this year for my birthday, I went to Texas to see her on her book tour,
Hmm.
and I thoroughly enjoyed it. And I'm actually really enjoying the book. And there's a part in the book where she says that um, breakthrough doesn't happen without breakdown.
Mm.
And that has been speaking to me this entire time since April, since I started reading the book. And if I can impart that onto anyone who is considering going to pharmacy school or currently in pharmacy school, struggling with, keeping up and finishing or anywhere in healthcare, it helped me tremendously when I read that, because a lot of
Mhm.
times we don't understand that to whom much is given, much is required. So, sometimes it feels like things are falling apart when they're really falling in
Into
place and
place.
coming together. Yeah. So that was a, a, a eye opening moment, light bulb moment
Mhm.
for me when I read that.
'Cause it's like everything comes full circle at that moment, like, we was broke down
Yes.
to the
Broke
ground in
down,
these in
beat down, wore out.
in these professions, but we still persevered, and now we're here, and
Hmm.
we have evolved into the women that we are, the pharmacist that you are, the nurse that I am, and I
Yes.
am so glad that you came onto the podcast because you didn't have to do it, but you did.
I'm
You
more than
didn't have to
happy to.
you did not have to come on here, and it took a long time for us to get here. But I am so glad because everything happens in its due time and due season,
Yes.
and I am so appreciative of you. So, if you all have come to the end of this episode, thank you for listening. She is such a great guest. If you have any questions, you can send them to the Evolve Nurse podcast. You can go follow us on Instagram at the Evolve Nurse. For those students going back to school, just remember that you can do this. It might take some time for you to get there, but you've got it. For those who are going into the season of completing their NCLEX, because I know that you all just graduated. So remember that you've got it. It's just a test. These are just questions. They aren't there to fight you. And you have the option to become who you want to be. With that being said, I hope you all have a great day. And that is the end of the podcast.